Hi and welcome. My name is Jeanette Reynolds and I'm the infection preventionist, and I just wanted to welcome you if you're new to our hospital and to give you some information about standard precautions, transmission-based precautions, and the signage that we use so that you're familiar with the colors of the signs and what to look for and what to do when you see them. First of all, I just wanted to point out that it is the policy to make sure that we follow standard precautions with every patient interaction. And that means to treat all blood and all body fluids as if they're potentially infectious until otherwise proven. So we treat everything, every interaction with a patient with those standard precautions. If there is some positive testing that happens during the patient's stay or when they come into the ED and they're tested or they're admitted, then this may change to include transmission-based precautions as well. But this is always in addition to standard precautions. And we will also have specific signage on the doors for you and for any of the sitters that might be with patients or family members to know what to do when they come into the room, before they enter the room, and before they leave the room. There are basically 6 different types of transmission-based precautions. There are 3 major ones and then 3 that are kind of a mixture of 2 of those precautions. The main one that you'll see is contact. The second type is contact enteric. The third type is contact droplet. The fourth type is airborne precautions. The fifth type is a mixture of airborne contact. And the sixth one is droplet precautions. So I'll talk a little bit about each one and show you pictures of what those signs will look like. To start, a physician order is not required to initiate an alert or a transmission-based precaution. A physician order is required to end a COVID isolation precaution, but the other ones, they can end after a certain amount of time, which we'll talk a little bit about some of the major ones. A MRSA contact precaution stays with the person so that we can see the history. While transmission-based precautions, once they've been initiated, the patient's provider, the infection prevention department, and other members of the patient's care team will be notified. Appropriate protective personal equipment, which is PPE, will be provided for all staff to ensure that they are adhering to the designated precautions. The duration of the transmission-based precautions varies and is different for each bug, and it just depends on the causative organism. In some cases where it would normally end, say after a week, you have to look at each individual patient because for some of those, they may be on ventilators, they may be in the ICU, and sometimes the doctor will choose to keep them on for longer for their protection, just so they don't pick something else up when their immune system is already compromised. And that's okay. It's not going to hurt them for those precautions to stay on and last longer. It's just that it needs to reach that minimum date and to ensure their safety and yours as healthcare providers and workers. Transmission-based precautions can be extended even longer for those with known immunocompromisation or underlying viral infections or diseases or conditions because they may have an increased risk of like a secondary bacterial infection, for example. So their precautions can stay on for longer. It's always important just to talk to the head nurse and have them talk to the doctor if you have any questions about that or why they're still on precautions. You can ask me, and I will also reach out to the head nurse and ask them to talk to the provider so that we can find out if the patient should remain on precautions if you have any questions. Transmission-based precautions are always used in addition to standard precautions. Sometimes diseases have multiple routes of transmissions, and so you'll see a sign that will include those multiple transmission-based precautions. They can be initiated and followed if there's a suspicion of egg bug and we're waiting for the viral or bacterial or even fungal test results to return, then those can go ahead and be initiated to protect everyone in the meantime. They should also be initiated when the patient has been identified as an infectious risk upon arrival to the healthcare facility, or when they develop signs and symptoms of a transmissible infection. Terminal cleaning of isolation rooms will be done in accordance to recommendations that are found in the CDC guidelines for environmental infection control in healthcare facilities. For specific precautions, we'll start out by talking about contact precautions, because these are one of the most common types that you'll see. And these are aimed at preventing the transmission of infectious agents which spread through direct or indirect contact. If it's direct contact, that would be skin to skin, shaking hands, for example. Indirect contact is touching a fomite, which is an inanimate object. That could be a towel, a linen, a doorknob, anything that is non-living but can be hosting a viable organism. And so contact with anything in the patient's environment. This could be the table, the chair, their bed rails, stickers or labels or charts that are in the room, equipment in the room. All of that is considered part of the patient environment. Contact precautions are applied to patients with known or suspected infections and clinical presentations that represent an increased risk for contact transmission. Contact transmission has the potential to occur when patients who are infected or colonized with epidemiology, if they're important pathogens. Colonization is an important term because that means somebody can be carrying a bug and they don't necessarily have an infection or symptoms, and they're referred to as asymptomatic carriers. For example, they may be colonized with MRSA, or colonized with Clostridium difficile, but they don't have signs of infection. But they still can transmit the bug, and somebody else on that ward may get sick. So that's why these isolation precautions are so important, because it protects the patient, it protects their family members, and it protects all staff members and healthcare providers working with that patient. Conditions requiring contact precautions, in which case you will see a yellowish orange sign. I'm going to pull this back up in a minute and go over all of the parts of it, but these are the signs that came from and are recommended by the CDC, which is kind of our gold standard of setting these precautions. But the first one that is put in place with contact precautions is a multi-drug resistant organism or colonization. This includes MRSA, which is methicillin resistant Staphylococcus aureus, vancomycin resistant enterococcus, which is VRE, and extended beta-lactamase ESBL producing organisms. E. coli is a big one. The other bug that you will see is respiratory syncytial virus, RSV, parainfluenza virus, and enterovirus infections. With those, if it is vomiting and diarrhea, then there's a special precaution called enteric contact precautions, and that sign is brown. Skin infections that are highly contagious or that occur on dry skin. If a person has herpes simplex virus, the cold sores, impetigo, pediculosis, which is head lice, scabies, cutaneous diphtheria, staphylococcus, which is basically a staph infection of the skin that results in boils or hair follicle infections with staph. Herpes zoster, which is chickenpox or shingles, which is how it reactivates later on. If a person has had a case of the chickenpox when they were younger, it can reactivate as herpes zoster later on. Both of those are caused by the varicella zoster virus. and anything that is disseminated in the immunocompromised host. Major abscesses where the drainage is not contained by the dressing and it's leaking, or there's no containment device, it's draining a lot, there's pus, and even when you cover it, the gauze gets saturated. Cellulitis and anything that is leaking fluid and blood, that would be considered contact precautions. Abscesses and infected draining wounds, including cellulitis, until the culture is negative for multiple resistant organisms, including MRSA, vancomycin-resistant enterococci, and other organisms. And viral hemorrhagic infections, including Ebola, Lassa, and Marburg virus, which are extremely rare, but we like to be prepared for everything just so we are hospital ready. Contact enteric precautions. These are for anything related to gastroenteritis, and for those you're going to see the brown sign, and this will be put up on the door even if testing is underway and the results haven't come back yet. The thing with this one is you want to make sure that you always use soap and water, not just the hand sanitizer, because alcohol-based hand sanitizer does not kill the endospores produced by Clostridium difficile or norovirus. It does not kill those virion particles. So very important to use hand washing techniques for those. The contact enteric precautions are used for patients with that known or suspected virus, whether or not you ever get the results back while they are in the hospital. So that is designed to protect the patient and to protect anybody working with the patient and in their environment. Precautions are expanded in that case, and they will include hand washing with soap and water and using that instead of substituting that with alcohol-based hand sanitizers. Since they do not decontaminate the hands fully with these types of pathogens, it's important that you follow that protocol. You also want to use a red bouffant cap to cover alcohol-based hand sanitizer in the patient's rooms. And that is just a reminder, when you see that, don't use this, use the soap instead. Some conditions that are requiring that, in addition to Clostridium difficile or norovirus, include known cases of hepatitis A, which is usually associated with like food poisoning. That one is self-limited. It does not typically permanently damage the liver, but that can spread. So you just want to make sure that they're on enteric precautions for that. For rotavirus, Shigella, or E. coli 0157H7, which is also sometimes referred to as traveler's diarrhea. That one is a bloody type of diarrhea produced by that toxigenic strain of E. coli. The next type of precaution is the droplet precautions. Droplets are meant to prevent the spread of pathogens through close contact with respiratory and mucous membranes or secretions. Droplet precautions are implemented for patients with known or suspected to be infected with pathogens transmitted by respiratory droplets, which are greater than 5 microns in size. So they don't travel as far, but they land on surfaces and they can live on surfaces longer than airborne particles. They are generated when the patient coughs, sneezes, sings, talks, or during certain procedures that cause droplets to form. It can also happen when somebody flushes the toilet and does not have the seat covered. It can spread that way. Hand dryers, those big air blowers in bathrooms in public, can also spread droplets that way. So those are just a couple of things to be mindful of in the community as well. Transmission of large particles usually occurs within 3 feet of the source, but it can occur up to a range of 6 to 10 feet maximum. Conditions requiring droplet precautions include invasive Haemophilus influenza type B disease, which is bacterial and often causes bacterial pneumonia or even meningitis, epiglottitis, which is where the epiglottis in the back of the throat swells up, and sepsis, which is bloodstream infection. Invasive Neisseria meningitidis disease, including meningitis, pneumonia, and sepsis. Other serious bacterial respiratory infections by droplet transmission include diphtheria, which is pharyngeal, the back of the throat, mycoplasma pneumonia, which is walking pneumonia, pertussis, which is whooping cough, pneumonic plague, and streptococcal group A pharyngitis, strep throat, pneumonia, or scarlet fever in infants and young children. Serious viral infections include adenovirus. Usually that causes the common cold. However, with patients who are immunocompromised or they are in the ICU or they're recovering or they have underlying issues, that can actually cause serious infection. So that's why droplet precautions are important for things like adenovirus and rhinovirus, which would just cause the common cold in somebody who's otherwise healthy, but can be more serious in somebody who has other things going on. This is also required for influenza, and for influenza, that is for 7 days. For mumps, parvovirus, which is known as erythema infectiosum, and rubella, which is the German measles. So with that one, you're going to see a green sign. And again, I'm going to come back to all these signs and go over them in more detail. But here is the green sign that you'll see on the door. The next one is airborne precautions, and that's going to be a blue sign. And that looks like this. So airborne precautions are aerosolized particles that are less than 5 microns in size, and they travel farther and they last longer in the air before they land. So these are suspended and they remain infectious while they're in the air. Airborne precautions are used for patients known to be suspected of or are infected with epidemiologically important pathogens that can be transmitted person to person via the airborne route. Microorganisms can be dispersed over long distances by air currents and inhaled by susceptible persons and have been known to travel up to 30 feet, which is pretty far. There's a pretty cool picture online that shows somebody sneezing and you can see those particles and how far they travel, and it is absolutely crazy. Conditions that require airborne precautions include known or suspected pulmonary or laryngeal tuberculosis and measles, which is rubeola. Airborne contact precautions are a mixture of airborne and contact precautions, and this is needed for varicella virus, which is the chicken pox. And that is because it's spread via the airborne route as well as through contact with fluid-filled vesicles. So both means can transmit the disease. If it comes back later and disseminates as herpes zoster, which is shingles, that also would require the combination of the droplet contact or airborne contact. Smallpox and extrapulmonary tuberculosis in a draining lesion. I've seen this one more often than tuberculosis of the lungs because, believe it or not, a lot of people have fish tanks and will clean them out without putting gloves on. If they get a bite or scratch, this is very common in dirty fish tanks, and that organism can get into the wound and cause a wound infection. So I've seen a lot of finger infections with this organism. Healthcare personnel that are caring for patients on airborne precautions should wear a mask or a respirator. Your N95, which you've been fit tested for or will be fit tested for, is the type of mask that you would need for going into this room. It is also going to be a negative air pressure room. And you should don this mask before you enter the room so that you are ready to go. You should push the seal around your nose. That way it's fitted to you and around your mouth. And whenever possible, non-immune healthcare workers should not care for patients with vaccine preventable airborne diseases such as measles, chickenpox, or smallpox. For patients with suspected or proven SARS, COVID-19, monkeypox, avian influenza, or pandemic influenza, the most current CDC recommendations are that isolation needs to be strictly followed. So in addition to our standard precautions, again, you will see these signs hanging on the doors. They are laminated and they're washable. You can wipe them off with the wipes. Make sure they get thorough and wet when they are cleaned and allow them to air dry. On one side, you're going to see the precaution. It's going to have a red stop sign, and that will alert you to stop and read it before you go in the room. Healthcare workers, environmental services when you're going in to clean the room, and family members of the patient need to stop by the nurse's station first if they see any of these signs on the door, and talk to the nurse and the staff about what they need to do before they go into the room in order to prevent the spread of disease and prevent any outbreaks in the hospital. So visitors need to report, and it does say that on there. They should go by the nurse's station first. And in addition to following the standard precautions with the blue sign, airborne precautions, you would need to clean your hands when entering and leaving the room. Doctors and staff need to wear the PAPR mask or the fitted N95 mask prior to entering the room. And airborne infection isolation room is required. That's a negative pressure room, and the door should always remain closed when patients are on isolation. A lot of the doors have been open, and this can spread disease because, again, you got to remember that these droplets or aerosols are traveling in the air. So we want to try to keep that isolated by keeping the door closed as much as possible. You can flip each one of your signs over if you're not sure, and it will tell you exactly what are the common conditions for these common precautions, what family and visitors, what they need to do. They should, if previously exposed, wear a surgical mask. And then after the patient is discharged, keep the door closed for an hour, then start the routine cleaning procedures per the hospital procedure. Discontinue precautions as per hospital policy or by the infection preventionist instructions. So that is going to be very helpful to you to look at when you're not sure. And they always stay on the door. The next one is droplet precautions. So once the patient leaves and the room is being cleaned, you can just turn the sign over and it'll face this way, and we will know that the patient in that room is no longer on isolation. So the green one is droplet precautions. Once again, you're going to follow standard precautions too. Visitors should report to the nursing station before they enter the room, and everyone needs to clean their hands when entering and when leaving the room. Also, you should wear a mask. It could be a surgical mask for droplet precautions. This means the patient needs a mask on, the visitor needs a mask on, the healthcare worker needs a mask on when they go into the room. Doctors and staff, if they contact secretions or come into contact, then they need to wear gowns, gloves, and even eye cover. It will tell you on the back what the droplet precautions are, and the most common one that we see is influenza, along with some other things. Like right now there has been some rhinovirus and adenovirus, which are typically the common cold, but those are droplet precautions. We should limit visitors to those who've already been exposed Display the sign outside the door, and discontinue precautions as per hospital policy or infection preventionist instructions. So you can always call and let me know who you're talking about and what precaution they're on and what for, and then I can let you know when their precautions can end. So again, it depends on the kind of bug that they've been diagnosed with. This one is also a very common one, the droplet contact precaution mix. These are bugs that can be transmitted both by droplets and by contact. So we have the combination of two when you see the white sign on the door. Visitors need to report to the nursing station before they enter, and everyone needs to clean their hands when they enter and leave the room. Everyone needs to wear a mask and preferably some eye protection as well. Everyone needs to wear a gown and gloves if they're going into that room. And any aerosol generating procedures require respirators. So always keep that in mind, especially if the patient is needing to transfer or be transported for a procedure. You can cover up that equipment and make sure they wear a mask. Contact enteric precautions. The sign is brown, and again, these are all related to gastroenteritis. Visitors should report to the nurse's station. Everybody needs to clean their hands with soap and water, not substitute that for the alcohol-based hand sanitizer. Washing hands with soap and water means to scrub both the front and backs of the hands, in between the fingers, scratching the grooves on the palm of your hand so that you get in those creases and grooves. Scrub under the fingernails, go up about halfway up your wrist to forearm, and then lather it up very good, rinse, and that's about for 20 seconds, and that's recommended by the CDC to the tune of the Happy Birthday song. Also, clean your hands the same way with the soap and water before you exit. The gown and gloves should be put on at the door, and doctors and staff must use patient-dedicated or disposable equipment, clean and disinfect shared equipment. And if there are some things that you need in the room, you can always put a bag over it, such as a scanner, if need be, for these types of precautions. So the most common ones that you'll see with this are any acute diarrhea, nausea, vomiting, and norovirus, rotavirus, C. diff, and then unknown cause of diarrhea. And then we have our contact precautions, which is the most common one. This one is a yellow-orange sign. Visitors should report to the nurse's station first. Everybody needs to clean their hands when entering and leaving the room. Gown and gloves should be put on at the door, and doctors and staff should use patient-dedicated or disposable equipment, clean and disinfect shared equipment, make sure that it gets nice and wet, and that everything air dries. If you're using alcohol-based hand sanitizer, it should stay wet on your hands for 15 to 20 seconds and allowed to air dry. Don't shake it dry, but just allow that to air dry. MRSA is one of the most common things that we see contact precautions for, but also things like wounds where cultures are being done and we don't know what it is yet. MRSA for sure. Invasive skin and wound infections with things like group A strep, staph, boils, shingles, chickenpox, impetigo, lice, scabies, herpes simplex virus, major wounds, abscesses, and things that are draining. So all of those should be contact precautions. Conjunctivitis, which is pink eye, that is a contact precaution. And COVID is a combination of droplet contact. So this, you'll see this sign a lot. For gloves, if you see the word don for gloves, or gowns, donning means to put something on, and doffing means to remove it or take it off. So I'll have a separate video for kind of how to don and doff your PPE, but that terminology is important to understand as well. All right, I hope that this was helpful learning the signage, and I will post some videos separately of hand hygiene and of understanding some of the requirements for sitters or for visitors of patients as well. Thank you and have a wonderful day.